The 805 Focus is brought to you in part by Nonprofit Connect. Nonprofit Connect provides superior leadership tools and resources so nonprofit leaders and board members can make valuable decisions to move their organization forward to a sustainable and vibrant future. More information on services online at nonprofitconnect.org.
Welcome to 805 Focus. I'm Dr. Cynder Sinclair with Nonprofit Connect, and we will be bringing you the latest on your favorite nonprofits. So get ready to be inspired. Our special guest today is Ernesto Paredes, and Ernesto is Executive Director of Easy Lift Transportation. Welcome, Ernesto.
Thank you. It's a pleasure to be here.
I'm so glad you're here.
Thank you.
Wow, and Easy Lift has been very busy, as always, but very busy, especially these last many months. So tell us about that. What's it like?
It has been a challenge like all our brother and sister organizations. It's been amazing. But for me, I've been with the organization about 30 years now, which is it's starting to wind up. So I think I'm just off of my probation period, so things are good. But it was actually a very exciting time for me because I guess we are called seasoned veterans now.
There you go.
It's great to be able to have new challenges. And boy, was this one of the biggest challenges I think not only this country, but this world has ever seen. And so that didn't go unnoticed with us and our passengers. So as the community unfortunately had to shut down, that kept a lot of individuals from using our dial-a-ride system and getting to a lot of places where they normally go on a daily basis. And as you recall, our bread and butter program is our dial-a-ride. And our dial-a-ride is for frail seniors and people with disabilities that can't use the MTD bus. That's essentially what qualifies them.
Okay.
And then they can go anywhere. We pick them up at their doorstep and take them anywhere on the South Santa Barbara County for $3.50 per ride. So
wow,
$7 round trip is pretty good, although there are individuals out there who are on fixed incomes. And if they're going 3 or 4 times a week to dialysis or going grocery store shopping, that definitely adds up for people. So we will never deny people because of their inability to pay, ever.
That's good.
But there's individuals that are on the other side who are in a very good position, and they're able to really donate to us during the holidays especially. So it works out really well.
That's great.
Yeah, it really is.
And so they can go on your website and figure out how to do that.
Go onto our website. We make it very easy for people to donate who can. And again, when they donate, it just gives us the ability to be able to provide even more transportation to our friends and neighbors in our community, trying to get places. You mentioned, what happened obviously with COVID shutdown. As our organization, we had the drivers, we had the vehicles, but our capacity went from 300 to 400 rides a day down to about almost 100. So really about a quarter of that, maybe 30%. But there are still people that needed to go to dialysis treatments, for example. You can't not go to dialysis.
Yeah.
And there are certain medical appointments and access to food. Those are things where people were still going to.
Yeah.
But we still had this group of individuals and drivers allowed us to pivot and shift some of our services and partnered with specifically Eric Talkin at the food bank. So we were able to initially bring food not only to individual homes, but in some cases bring food to the actual distribution sites. Because this was before the National Guard got involved and were able to help Eric. So until then, we were able to really step in and help out. Also, we teamed up with our friends David Selberg over at Hospice of Santa Barbara and helped deliver these COVID health kits to families who were on the outer skirts and hard to reach individuals. And so we were almost anywhere and everywhere in our vans, it made it really easy for us to access and give those individuals these health packs. So it's worked out really well. Also, we teamed up with the County of Santa Barbara. The idea was to gather the very vulnerable homeless population that were living in the streets. And we didn't want them to be exposed because it becomes a public health issue if they get sick because they're going to be all around us.
Yeah.
And so there was a local hotel that was designated for these individuals to be housed during this pandemic. The county partnered with us to be able to provide transportation for those individuals so that they can still access health care and, again, food access too. So it's worked out really well for us.
Wow.
Yeah.
So what was a huge challenge, you flipped it around into quite an opportunity for many, many people.
We want to think of ourselves as the community's transportation. I mean, we can't solve everyone's problems or challenges, but we definitely want to be at least at the table and try to see if we can be a solution.
Yeah.
You know, towards the latter part of this pandemic, you know, we, once again, our favorite thing to do is to partner. And we collaborated with Ron Werft at Cottage Hospital and Family Service Agency with Lisa Bravo. And the idea was there was, identified a lot of, in the Latino community, there was people on the margins that weren't being able to access coming to the hospitals. They weren't coming to the neighborhood clinics to get vaccinated. So we thought, let's provide this transportation for these individuals. And so we did. We partnered and brought a lot of people to the Goleta Valley Cottage Hospital vaccination site, which was an unbelievable setup. They did a great job. And so for us, it was a pleasure to be partnering with such great organizations, both Cottage and the Family Service Agency.
Gosh. But you know, kudos to you for really being open to all of that challenge and turning it into opportunity, for being so creative and spontaneous and really, as you always do, ear to the ground on what people need, what they're asking for, and then responding to that.
Well, thank you. I wish I could take all of that credit. I have a wonderful, incredible staff, as you can imagine, who are always thinking ahead of what our community needs are. You know, both our Director of Operations, Christina Laterio, and our longtime Operations Manager, Renee Andrade. In fact, Renee was the first person I hired back in 1991, who's still there today.
Oh, man.
And so he really has that ear to the ground and understanding what's needed. Let me give you a quick example of how that happened just recently. You know, the Alta Vista fire that on TV Hill just happened recently. And the fire started, and Renee lives in downtown Santa Barbara, and he kind of saw that smoke, and it was an early evening. And you know, the way Renee's mind works, he thought, I'm going to contact Serenity House and see if they're going to need any evacuation. Well, he called up to Serenity House, and they said, you know, I don't think so. The fire moved so quickly, we ended up evacuating all the staff and all the patients at Serenity House, which is not an easy thing to do. And there's such a vulnerable population there. So, you know, our staff are always trying to think, well, how can we better serve this community? You know, we teamed up with Heidi Hawley at Friendship Center and Abe Powell with the Bucket Brigade to provide, you know, meals for a lot of seniors also. So again, it's that ability to really look, you know, be open and think of our vehicles as the community's vehicles. We're just the stewards of them, but you tell us what you need and we'll try to make it happen.
Oh gosh, that is just so inspiring.
It's a lot of fun. I mean, it's a serious business, but it makes it fun when you're able to kind of do it the old-fashioned way, Cynder. It's not always an RFP or these, you know, these requests for proposals that you have to get out there. But sometimes, not always, but sometimes a good handshake and just, I know who you are, you know who I am. There's a trust factor.
Yeah.
We can get a lot of things done immediately, which is, again, it's a pleasure to be able to be in a position to do that.
Gosh, well, thank you for your brilliant leadership to make that happen. And I know you're going to say, a team. And yet, you are the thread that binds all that together. And we are grateful to you.
Well, thank you, Cynder. Appreciate that. And again, I have to, you know, credit you also, because you were one of my early mentors that, you know, you did pick up the phone when I would call, and you would give the advice, and you reached out for my opinion, even though you'd been in the, you know, in the sector longer than I had. It's that recognition that we all have something to bring to the table. We have different life experiences, and I think my book has contained a lot of other people's pages of their books.
Yeah.
And your book, literally in your book. You know, and that's what helps us. And my job now is to share that information with people like Christina and other emerging leaders out there to see, you know, they're the ones who could take the baton from us, and they'll say, how did you think about doing that. And hopefully it was a passed on idea and almost a culture within our nonprofit area.
Yeah, and speaking of the culture and the nonprofits, it's like almost everyone I talk to, they have been, rather than sort of downtrodden from the challenges of COVID, they have been energized and reached new heights of creativity because of it.
Cynder, it's an opportunity that a lot of us have been really good managers of our organizations for many years. Mm-hmm. When there's times of crisis, whether it's a localized crisis, an organizational crisis, it gives us the opportunity to be leaders.
Yeah.
And that's not, you never know how you're going to respond at a car accident, if you're going to run towards the accident or run away. Yeah. This is the same thing. We have, as leaders of our organizations, we have a responsibility not only to our staff and the people that we serve, but our community. Mm-hmm. And so, we have to take that leadership responsibility, which is good because we have to be able to make quick decisions. And the hardest part, to be quite candid, is sometimes learning how to turn that off at home.
Oh.
There's a job, and then there's the rest of your life. So you have to kind of be able to balance. There's that big word of balance in life. And again, I think a lot of leaders can get caught up in the constantly trying to improve and grow and partnerships, but still we have to be able to take care of ourselves too.
Yeah, that's a good word. And so 30 years at Easy Lift, I bet you have a story or two to share with us.
Or 3 or 4.
Yeah.
Or 5. Yeah, no, it's been wonderful. And again, when I started with Easy Lift 30 years ago, I thought, can there be anything less sexy than transportation? Now I say no, there can't be. But like it's the stories, it's the people, it's the families that we have impact. It's that analogy of the pebble and the ripple effect. And we have a gentleman who uses us 5 days a week, Roki Fukumura, who is later this month will be 99 years old.
99.
And he still works every day locally here at Tri-County Produce.
Oh,
he's been in the produce industry, most of his life, his adult life. And it's, because of doctor's orders, he can no longer drive, specifically in the evenings and early mornings. So our van picks him up and takes him to work. And I tell you, it is that quality of life that we're able to continue giving to individuals, to Roki specifically, but the inspiration he has to the customers who are there, the other workers. It's one of those multi-generational opportunities that it's such a pleasure to be able to provide a Roki a ride every day.
Oh gosh.
Yeah.
That is such a sweet story.
In fact, and he told us he's determined to keep working until he turns 100 next year. So if you have a chance, get out and say hello to Roki at Tri-County Produce.
I'm going to make a point of doing that.
That'll be great.
Gee whiz, I'm sure he'll probably be the only 99-year-old there.
But the challenge is he doesn't look 99.
Oh.
So good luck. He looks like everybody else. Because of his lifestyle, he's looks wonderful. He keeps going, and he's the Energizer Bunny, from my understanding from the staff there. So
wow, isn't that the secret, to keep
going? Keep going, keep busy. Yeah.
So back now to COVID time. Mm-hmm. Could you have only a few people in each van? Is that why there were fewer?
It's a great
trips?
question, and that was a challenge because we want to be during normal times, we want to be as efficient and effective in group rides so that we can provide as many people in one vehicle going from one part of town to the other. But because of COVID, we had to take the CDC's recommendations. Nothing had to, it just made sense to, after every rider, we would have to sanitize the vehicle. Everyone had to be by themselves. We couldn't have multiple people on board. And that's a very costly single ride. So, thank goodness we didn't have as high a demand, so it was okay for the time. But now, as things are opening up, the demand is definitely creeping up closer to where we were pre-COVID days. So, but people are still concerned. The people we serve are truly the most vulnerable. They're frail seniors, people with disabilities already, so they already have underlying health conditions. So we're trying to be very careful in working with them and their families.
That is great. So when people get on the bus or on the van now, they have to wear a mask?
Have to wear a mask, yeah. And our drivers wear a mask. And the thing is, there is no 6 feet distancing because our drivers have to secure wheelchairs, and you're right next to the individual.
Oh.
So we do the best we can, with what with what the guidelines are. But we're very fortunate that we have about 96% of our staff are vaccinated, and just a couple people who are part-time have chosen not to. So that's something that we have to continue to work with.
Oh, gosh. So during the height of the COVID, are you saying that you could only take one person at a time?
In a van, in one van at a time.
One person in, oh my
Yeah,
gosh.
and again, so it was challenging. So our drivers were absolutely hustling because people still need to get to places, like we were saying. But again, the good thing is, we had what was going on. People understood the dynamic. So people weren't as insistent on being exact. They're being more flexible with us, which we appreciated because everyone knew we were all doing the best we could with the information we had at that time. So we're still not out of the woods yet,
Yeah.
but it's something that Santa Barbara and the Santa Barbara area could be very proud of, the nonprofit sector and how we all have come together and worked with one another. And again, most of us know at the very least by first names or know each other because we all participate in each other's organizations and events. So it's with that advantage that we are able to have the cell phone number on Eric talk and say, hey Eric, what do you need? Where can we transport food immediately? And not have to wait for an email from the county looking for services. So it's again, we're very fortunate in this community.
So yeah, we are.
And to have quite honestly, to have a program like yours, to be able to share what we're doing to everybody so people can get involved into their favorite charity, whether it's with the environment, the arts, human services. I mean, we're all, that's what makes this community great is we all have people that want to serve and either on boards or as donors or as some people might take it as a job too. So it's a wonderful, wonderful place to be.
It is indeed. So I'm thinking about other communities. Do you think that other communities have this sort of service? I mean, they probably have a dial-a-ride, but yours is so much
we have a very unique model. That's actually a great question. It's a very unique model where most communities in California, the dial-a-ride portion is run by either the city of or a district, kind of like where MTD is. MTD is a district because they cover South Santa Barbara County. That's their district. But what MTD did back in 1990, when the Americans with Disabilities Act was passed, they were responsible for making sure there was a specialized transportation out there, an ADA specialized transportation. But Easy Lift was already in existence, and they said, hey, let's just partner with Easy Lift, bring them up to snuff, and make sure that that all the certifications are in order. And since 1990, we've assumed the responsibility of the Americans with Disabilities Act transportation here in South Santa Barbara County. So, and as a nonprofit, we're able to fundraise and really be able to do things that are outside of the mandates. When people know that there's more than what the government says that we need, we in the nonprofit world know that we're a safety net, and sometimes we go beyond the call of duty because we're working with people.
Sometimes, I'd say a lot.
A lot of times. And again, I remind my staff, I mean, we're a human service, and it's in the word, human service first.
Yep.
We're working with people before all the other regulations. I'm not saying we don't follow regulations, but we also definitely think, what would you want to do for your mother?
Yes.
That's kind of our litmus test is our transportation want to be a great for your mother, for my mother, for our neighbor's mother. And if none of our if any of our drivers or any of our staff is someone that we wouldn't want to interact with my mom, then they wouldn't work for us. It takes a special individual to not only be a professional driver, but to have a very compassionate heart.
Gosh. And so staffing, everybody's having trouble with staffing, and you sound like, I mean, you have staff and you train them well, and you're very careful how you choose them. Very
careful, but Cynder, in the 30 years I've been with Easy Lift, this is probably the third time in 30 years where it is very challenging to recruit. We've been great to be able to retain wonderful staff. It's the recruitment as we're building back up and the numbers are going higher. Recruiting for transportation, and I sit on the board at Cottage Health. I also see there's a challenge in trying to recruit for healthcare workers because there's higher regulations for those individuals. Although recreational marijuana use is legal in California, it's not legal in transportation. There's zero tolerance in healthcare and in transportation. And so some people choose not to, take that job because I can make close to that same amount of money and not get drug tested.
Oh my
and
gosh.
so it is challenging. So there's things that people like about the passage of that, but on our end, it gets challenging. And of course, rightfully so, we want to make sure people are clean and very clear-headed when they're providing transportation for our friends and family.
Well, we have about a minute left. Is there anything else you'd like our audience to know about Easy Lift Transportation?
I think when you see the vans, I want people to really feel that although they may not need us today, to remember us, because there might be a time when their families or their neighbors might be struggling and transportation might be a challenge. Call us. Let's assess and making sure that we could provide that transportation for individuals, because there are some people, quite honestly, Cynder, that probably should not be on the road who are traveling because they need to get that prescription. They need to get access to food. Let us do the heavy lifting. I mean, it's Easy Lift. It's in our name. Let us do that work so that, again, all you have to worry about is what your daily needs are. And again, I think families, especially that live across the country, can have that comforting feeling that we got it. We got you covered. We got your mom and dad covered.
Well, thank you for the unbelievable service that you provide to our community. And I know a lot of people watching this will want to get out their checkbook or get on your website and push that donate now button.
Please do.
And
Please
contribute, because it's so important.
I think people forget how important getting from one place to another is. And so, thank you for saying that.
Yeah. Well, thank you for all your good work.
Thank you,
and
Cynder,
for being on our show today.
My pleasure.
And thank you for joining us on 805 Focus, and we'll see you next time.